They sent me home, refusing that anything was wrong with me. I had gallbladder surgery a week later.
The paramedics took me, but not my dog, my service animal.
They say that we let them take our land and now we ask for health services, but they took it from us. We faced so much racism.
They refused to call me by my own pronouns, then lectured me about how I was a disgrace.
Hi, I'm Lakshmi.
I'm Jenna.
I'm Thanisha.
And I'm Sahana. These are the voices of minorities that represent the Black community, the disabled community, Indigenous people, and LGBTQ+, and the neglected experiences in the healthcare setting that these minority groups face. We are Fair Care Awareness, a campaign that aims at educating our community on the prevalence of these health and healthcare disparities.
In the face of adversity due to the pandemic, we initiated our campaign virtually, but found it difficult to interact with our entire community online. Expanding on several social media platforms helped us grow our campaign and receive support, similar to if we did have face-to-face interactions.
Specifically, we interacted with our community through our Instagram account by posting infographics, videos, and a virtual bulletin board, each dedicated to teaching on different aspects of healthcare disparities. We also built and designed a website that included a blog, a chat feature, access to our social platforms, fundraiser info, and more informative resources.
Eager to learn more about this topic, we conducted a survey to get a better understanding of how this issue is prevalent in our area. Our survey data revealed that 21% of our surveyed sample has experienced or knows someone who has experienced discrimination in a healthcare setting, 92% of which either have an ethnic background, are female, or are part of the LGBTQ+ community.
With this in mind, we decided to reach out to medical professionals in our community who are willing to speak on this issue and give us a medical standpoint on disparities and how we can address them.
We made sure to amplify the voices of these experts on this topic over our own, which is evident in our launch and support of Disparities Discussions series on our Instagram TV and Spotify podcast. By featuring local medical professionals and community integrated medicine at MSU, we not only push for transparencies in the discrepancies in healthcare, but we also increased our personal awareness on this issue.
After learning about the disparities from medical perspectives, we extended the reach of our campaign by spreading our newfound knowledge to the youth of our community, including Power and Warner Middle School, at which we virtually presented a slideshow on this topic.
To help Indigenous communities that were terribly impacted by the virus, we started a GoFundMe fundraiser for the First Nations Institute COVID Relief Fund for Native Americans. We were able to raise $230 for Native communities most in need in the nation. The community participation we received became the foundational support of our campaign for our future endeavors.
Our newest collaborator, MyDigidoc, a 501c nonprofit that provides free medical services to the public, collaborated with us on our fundraiser through bingo boards and dares to donate on our Instagram stories, as well as selling wristbands with our campaign slogan. We were thrilled to interact with our audience while raising money for an important cause.
Coming from privileged backgrounds, our failure was that our personal experiences blinded us to the severity of the disparities minorities face, and we initially struggled to understand their perspective. To overcome this, we held ourselves accountable for representing minority voices rather than speaking for them. As an example of this is in our Disparities short film, which portrayed a montage of minority voices expressing real-life incidents where they were neglected in the healthcare system. Along with this, there was an informative breakdown of specific disparities from our team.
Our most apparent success was the new skill sets we acquired through interviews with medical professionals that taught us how to drive professional dialogue, skills that also pertain specifically to professions in the healthcare setting that involve being an advocate for minority patients. We also learned how to network our campaign to connect with people who would be willing to share their knowledge and resources with us and our community. In total, we impacted 3,580 people.
It's a shame that we live in a country where not all people are treated equally, especially when it comes to their healthcare.
We want to live in a world where our Indigenous people are treated fairly on their own land,
where our doctors are taught how to treat their patients properly, no matter their sexuality, disability, race, or ethnicity.
The first line of the HOSA Creed states, "I recognize the universal need for quality, compassionate healthcare. As HOSA members, it's our duty to use the opportunities HOSA has granted us to fulfill this mission through fair care awareness, reminding our community it's not care unless it's fair.